It can be hard to talk with someone about their traumatic experiences. There are times we may feel uncomfortable, unprepared, or we may worry about saying the wrong thing. And whether this is your first day on the job or if you've been in the field for decades, these concerns are common, and there's always room to enhance our trauma-informed engagement skills. In this video, we'll cover a few simple and practical ways that we can do that. The essence of a trauma-informed approach means shifting our perspective from what's wrong with an individual to what happened or what has this person experienced. From there, we can ask ourselves, with this understanding, how will I change my approach? To better understand how a trauma-informed approach can transform the way we engage with others and understand behaviors, let's observe an example, starting with a non-trauma-informed lens.
Hannah meets with an intake worker, Camilla, at her home. Camilla arrives to Hannah's house and waits outside for 10 minutes because Hannah is running late. When Hannah arrives, Camilla notices that Hannah is avoiding eye contact, often pulling out her phone to text during their conversation. Camilla sees Hannah's lateness as a sign of non-compliance and makes a note in her chart. She feels as though Hannah must not really care about obtaining services. She also feels personally offended by Hannah's texting, which she perceives as disinterest in the conversation. About halfway through their meeting, Hannah suddenly discloses that she recently experienced an assault. She says she has been missing work, is having trouble sleeping, and feels anxious around groups of people. Camilla feels caught off guard and unsure of how to respond. She hurries through the rest of their meeting, making sure to hit on all of the questions she had planned to ask prior to Hannah's disclosure. When documenting the information, she notes that Hannah was late, appeared disinterested in services, and includes a note about her concern for lack of motivation for treatment. When Camilla leaves Hannah's house, Hannah feels worse than she did before. She wonders, if she can't help me, who can? She decides not to respond when Camilla contacts her to schedule their next appointment.
When utilizing a trauma-informed lens, small changes in our approach to engagement and understanding of behaviors can make a big difference in the exchanges like the one between Hannah and Camilla. A trauma-informed human services professional looks to set the tone, navigate the conversation, and finally, wrap up and follow up. When setting the tone for trauma-informed engagement, a few things we can do include explain our role, normalize how difficult it can be to participate in services and share personal information, and thank individuals for sharing. Let's look at that scenario again, but this time, incorporate some basic trauma-informed strategies.
Hi, Anna. My name is Camilla, and I'm so happy to be meeting with you today. I noticed you were running a few minutes late. Is there anything I can do to help make our meetings easier for you to manage? I'm hoping that we can work together to identify how to best meet your goals. In order to do that, I want to get to know you as best as I can. I know it can be really difficult to talk to anyone, let alone a stranger, about many of the things I'm asking you about, and I really appreciate your sharing and trusting me with this information.
Once a conversation is underway, some strategies include letting the individual lead the conversation, talking with the individual not only about what they've been through, but also how they got through difficult experiences, normalizing the individual's reactions to experiences, and using everyday terms. Let's look at our scenario again using these strategies for navigating the conversation.
Hannah, I know we mentioned earlier how difficult it can be to meet with someone new. I want you to know that you don't need to share anything you're not comfortable sharing. What you've shared with me is incredibly brave. It's very normal for you to feel the way you feel, given what you've been through. I'm struck by your story of what you experienced in your past when you mentioned the bullying and how you got through that.
Finally, after a conversation about difficult or traumatic experiences, it helps to thank the individual for sharing, be clear about what will happen with the information they've shared, ensure that the information is communicated to relevant team members, and make sure a connection is made with appropriate services or supports. Let's look at our scenario one final time, this time to watch for these wrap-up, follow-up strategies in action.
Hannah, thank you so much for taking the time to meet with me today and for allowing me to get to know you. Can we spend a few minutes now going over what you can expect from our agency going forward? I know we didn't hit on everything today, and that's good. It means we're connecting and really getting to know you and your story. We'll get the other information later. For next steps, if you're comfortable, I'd like to talk more about getting you connected with someone who can provide support, specifically around some of these experiences.
Incorporating simple techniques like the ones covered here when engaging with others can help build trust and rapport and can lead to more effective and person-centered planning. For more information, please contact our team at the address listed here.